I actually knew I wanted to be an OB from college, so I kind of entered medical school and applied into residency knowing that this is what I wanted to do. I just was really, in the beginning it was more scientific, where I just thought the development of an embryo was really, really interesting, and lots of kind of fun things involved in that. And then, as I had a lot more clinical experience, it just was a fun field, dealing with someone's pregnancy and deliveries. I thought it was just a fun time of life to be involved in with someone. I have a lot of doctors in my family, so I have really good examples of what a good doctor is. So, it's always from grade school on. I think that's just kind of what I knew I was going to do. It worked out. One thing that I find very important when I do see patients is education. A lot of times people come in, they see their doctor, and they leave their appointment not really knowing what was done or the rationale behind, giving a new medication or a test. So I do feel it's very important to be very upfront to kind of explain my thought process with patients, on a kind of a lay level that they can, without all the medical terminology, that they can understand. The most important part of the education is preparing them to end up with a healthy baby, and that includes going over medications and lifestyle and diet and activities that will prevent them from harming either their baby or themselves. The most important thing in selecting an OBGYN is really to make sure that they're going to have a personality that fits with you. You're dealing with very sensitive issues and topics, especially in OB and GYN, that you want to feel comfortable being able to talk to your doctor about them. So, definitely getting referrals and advice from your friends or family who may have seen the doctor before, to just kind of know ahead of time if maybe your personality fits well with them, and you'll be able to get along and have a good relationship and build a rapport with them, from the first visit. Personally, I had a very good obstetric experience. I actually moved to Milwaukee when I was pregnant with my son, and it's interesting going through your own pregnancy while you're being the doctor for someone else going through theirs, and it was easy to form a good relationship with my OB because we obviously had a common interest, a common job. So the office visits ended up being much more friendly. Well, first and foremost, when I deliver a baby, I just want to make sure that the mother stays healthy and that the baby is delivered and is healthy and there's no problems during the labor and the delivery. And, I want to make sure that the woman is comfortable and all of her kind of birth plans are being met, if medically safe. So, it's really about kind of talking to the mom, finding out what she expects, asking her kind of along the way as new things come up, what she'd prefer, what she would like, and also kind of explaining to them and preparing the parents for any problems that may come up, so nothing that may happen unexpectedly they have never heard about before. Meadowview OBGYN is a really, really nice practice. I'm one of 5 doctors there. Everyone is very, very sweet and nice and good to work with, and I find them to be very compassionate if someone's having a difficult time or a medical problem that's making them come in, and you meet your nurse first and then come into my office and meet me and then do an exam, and it ends up just, I think, being a nice experience for the patient. Columbia Center is the birthing hospital connected to Columbia St. Mary's, Wtih, and us as Meadowview OBGYN practice, which is in the building next door, allows us the convenience of being very close by during a labor and delivery. So if anything emergent were to happen, we're right there. And all the doctors in the practice have a very good relationship with all the nurses here. Each nurse really only has 1 or 2 patients that they're assigned to, and the vast majority of the time it's just one, so they really can give that good personal attention to the patient. The books that I like to read are, from the English Victorian era, lots of those, classics that we all read in high school. Another one of my interests is cooking. Both my husband and I both enjoy that, so we cook a lot, always trying to find new recipes, watch lots of cooking shows. So try to find time to do all those things.